Oh my god, it's 6 now. Is it 6? Is it just... Oh, no, no, please. Oh, no, I fucking can't.
Phobias. An irrational or illogical fear of a particular object, class of objects, or situation. It could often be seen as easily curable from an outsider's perspective. However, the irrationality behind the fear is a huge wall to breach through. That's where therapy comes in. With phobias, modern technology such as virtual reality in particular has made exposure to a patient's fears more safe to handle and has been as effective as other exposure therapies. And so today, I'd like to introduce clinical psychologist Calvin Wang, who will explain more in depth about phobias and the use of VR therapy.
I am a clinical psychologist and postdoctoral researcher here at Concordia University in Montreal. But prior to starting this position, I had quite a lot of experience working with virtual reality in the treatment of specific phobias. So this is like arachnophobia, glossophobia, which is the fear of public speaking, fear of heights, you name it. So the typical therapies, so this is not just related to VR, but the most sort of evidence-based treatment for phobias is exposure therapy. So there's a lot of good science behind this showing that, exposure works, right? So you expose the person to their feared stimuli, so spiders and heights and all of those things, with the aim for a few outcomes. So we want them to learn that what they're afraid will happen with their feared stimulus will not happen. That's one. And the second thing is we want the patient to learn that through exposure, the longer you are exposed to your feared stimulus, you habituate to the anxiety.
As Calvin stated, exposure therapy is the go-to when it comes to phobia-related patients. Within exposure therapy, there are two main popular types of therapies widely used, which are
in vivo and imaginal. So I'm sure so in vivo is like being exposed to something in real life, like a real spider. Imaginal exposure is getting the person to imagine perhaps the spider and working on their response to that. There's a lot of evidence now actually showing that VR exposure, so to disgusting stimuli like in OCD, is able to bring out the same sort of emotions and to a very similar degree as in vivo exposure. But I would say that importantly, VR should be seen as a stepping stone towards in vivo exposure.
With Calvin's statements on exposure therapy and virtual reality, I decided to try an experiment on phobia-related VR games and document the after effects on camera. The phobia games we'll be trying out will be related to spiders since, coincidentally, I have arachnophobia, making me a perfect test subject. So to my left, this is Steve Shao.
Hi, I'm a third year uni psychology student, here to help out Daniel with his experiment.
To my right, this is Jason Chan.
Jason, TRC downstairs.
So the games I'll be trying out today will be Arachnophobia on Steam and Fearless.
So just gonna look here to add more spiders. Oh, okay. Okay. Arachnophobia. Exposure level 1. Oh fuck. Okay. Oh, it's fucking moving as well.
Just don't swing your arms or jump back, and we'll be okay.
Okay.
Oh, no, no, please. Oh, no, I fucking can't. It's on the fucking,
I'll start off by looking at it, and then if it compels you, you can look away.
Small spider walking across the table, man.
It's not too bad.
Okay, it just looks like an M.
I try to make it through this one.
Twice as large. Fuck it. Okay.
It's alright. Close your eyes. Look up, look up. Look up for a bit. Compose yourself.
It's so... How big is it? I just saw it. It's bigger than a fucking book. It's huge. Okay, can I close my eyes? Can you describe to me what it looks like?
It's just the original thing, but twice as big. It's gonna crawl to you, but it's not gonna do anything to you.
No, please, please. Please.
Would I suggest a DIY exposure? Probably, I'm erring on the side of no. And you know, there are chances that exposures, like you were mentioning before, exposures going wrong, right? Even with some of these things, they could become safety behaviors as well, which then maintains the disorder. So just off the top of my head, just to give you an example, let's say that somebody is very much afraid of spiders, and they thought that, you know, oh, I'm gonna pop in this sort of VR and get going with it, right? I'm just gonna expose myself to these things because I know exposure works, so blah, blah, blah. So they do it, but then what if they never take that second step, right? What if they never take that next step of actually interacting with a spider, of actually exposing themselves to a live spider, the in vivo component, right? But then you might ask them, they go, no, I'm okay when it comes to a virtual spider, like I'm fine. Right, but can you see that might become sort of a crutch, right? Somebody then just relies on the VR, but they never really go to that second stage. But again, probably most effective with the guidance of a clinical psychologist.
So tired.